When NHS services are handed over to private bidders, we're always told that competition is good, that it reduces costs and drives up standards. But there has never been fair competition between NHS and independent sector providers. The game has been rigged from the start. They face fewer obligations to report on patient safety or performance. They're not regulated in the same way by the CQC, nor are they subject to the same scrutiny from freedom of information requests. And they have sometimes been allowed to take on services with little of the scrutiny you would expect from a contract involving public money and people's health. Risk assessments have been glossed over, wildly ambitious financial targets accepted as fact. This is what happens when you have a government and commissioners that put ideology before evidence. All too often, they've fallen for the mantra that private is automatically, inherently better than public. They never explain why. They never come up with the evidence. At worst, we've seen the wider health service destabilised and imperilled. High-quality services have been lost because the staff who run them have left or been moved. NHS hospitals already in grave financial difficulty have been pushed to the verge of bankruptcy. At best, well, we just don't know, because it's impossible to make meaningful comparisons when we are not allowed to see so much of the data. What we do know is that more than £6 billion a year is spent on independent sector providers in England, and that amount is growing. In our new report, we're prompting the government and commissioners to ask the questions they should have been asking before the very first contract was signed. Does the private sector really provide value for money? Does it offer comparable quality and safety to patients? How does it impact on other services? Our patients deserve to have answers to these questions. The BMA believes in a publicly funded, publicly provided health service. But if there have to be independent sector providers, we have a message for them. It's not our job to support their shareholders, it's their job to support our shareholders, every man, woman and child who uses the National Health Service.